Hello and welcome to our series on wellness this week. I'm Nancy Pfeff from Joya Wellness and CBD, and I'm so excited to introduce my friend and another wellness colleague, Allie Austin from Duxbury Wellness. Allie's a chiropractor. She's the owner of the practice, and she's been in the wellness space for quite some time. So I'm really excited to have her share some tips and strategies and tools and insights on how chiropractic can help us with our overall well-being. So welcome. How are you?
Great. Thank you for having me. Nice to see you.
Good to see you. And I think it's so cool because you and your practice are probably about 15 minutes from my house. I know my husband has gone to you once and he has been doing religiously these wonderful exercises at night to help him.
Mhm.
And I know that there's a lot of things people don't quite get about chiropractic as a supportive strategy in their overall wellness routine. So I'd like to just invite you to talk a little bit about what you love about your work, how you got into it, and then we can get into some details about like actual techniques and things.
Okay, great. So I got into chiropractic. I was introduced to it when I was in high school. I was a competitive track and cross country runner. And somehow back in the 80s, my mom knew about chiropractic. So if I was having, with a lot of long distance running, your hips can become tight or out of alignment. And so rather than taking me to a surgeon or a medical doctor to get prescriptions, she took me to our local chiropractor, Dr. Carr. And so I had a great introduction to it. It really helped me be able to continue to run and train without having to take any time off due to injuries. And then when I graduated from college, I knew I wanted to do something in the area of helping people. And I ended up working in human resources for a few years. And that actually segued into different technology jobs. And after about 10 years, I realized I just did not want to sit at a desk all day long. And I really wanted to get back to working with people, helping people. And I just loved the concept that chiropractic is more about allowing your body to heal naturally without using drugs or surgery. And so then I went back to school and became a chiropractor. I was out in California and I went to school out there. And it allowed me also to be able to open my own practice, which is something I've always wanted to do is, run your own business. And when you're gonna build a business, you have to kind of pick where you're gonna be. So I moved back to my hometown of Duxbury, Mass, and opened the doors. And since then, it's just been a great experience. I've brought in massage therapy also to my practice, to Duxbury Wellness Center.
Mhm.
And so what we really do as chiropractors is focus on the alignment of your spine, but we really can work on any joint. And all of us, whether have stress, whether it's physical stress, emotional stress, chemical stress, and these stresses can create imbalances in our body, and that can lead to misalignments of your spine. And
Mm.
your spine is really where your central nervous system connects to the rest of your body. So by aligning the vertebrae and taking pressure off the nervous system can help alleviate any type of symptom that you may be having from that. In addition to doing chiropractic adjustments, I also use what's called the Graston Technique, which is a set of tools that works on soft tissue. So, it's not just used for neck and low back, but we can use it for other parts of the body as well.
Oh,
So really what I focus on is just trying to get people back to their natural state of health.
wow. I know before we started, you showed me the tools and I know you have them right there. You can kind of
Do
pick
you
them
want
up.
to see them?
Yeah, yeah.
Okay.
I think
So
it's
this is, it's called the Graston Technique, and it's a set of 6 tools. You can see they're all different shapes and sizes. And the goal of these tools is to break down adhesions or scar tissue that can occur in soft tissues, which can include muscles, ligaments, tendons, your fascia. So for example, this is a little one that's great for, working on hands or working on Achilles tendons or feet. Whenever our soft tissue undergoes stress, and most commonly that stress is due to a repetitive stress injury. So one of the most common examples right now is people looking down at their phones and computers. So when COVID hit and everybody went from working in an office to working at home, we have people, sitting on their beds with laptops, especially students, or, sitting at their dining room table looking down, which puts a tremendous amount of strain on all the muscles and ligaments and tendons in your neck. So these tools help me break down any adhesions due to any long-term repetitive injury and really help people get back to their normal activities, pain-free. And then in addition to that, I give people stretching and, as you mentioned, exercises that people can do outside of the office to really empower people to take more control of their own health.
Hmm. Well, I can definitely see how, as an athlete in the past, people might not know this, but you've done quite you've done quite a number of marathons and Ironmans and all that good stuff. You know the power of being consistent in the stretching, and
Yes.
I've seen it, as I said, firsthand with my husband's range of motion and myself. And I'm thinking, when people think of chiropractic, I think oftentimes they think of just those adjustments you make and getting the spine and doing different types of things like that with joints, but I don't think people think about soft tissue. We typically think massage, and I
Yep.
imagine, obviously the muscles and the skin, I mean, all that sort of connects to the bone anyway in some way, right?
Yes. Yep.
Yep.
So that is one thing that it's not all chiropractors do soft tissue work.
Mhm.
And the Graston technique is something I was working before I opened my own practice in Duxbury. I was working at a sports clinic in Boston. And that's really where I was introduced to the Graston technique. And then there is a process you need to go through training and actually get certified in the Graston technique. So that's something I added to my practice. And I really find that doing both the adjustments on, not just your spine, as I mentioned, you can also adjust, wrists and ankles and feet. So in addition to the osseous or kind of bone and joint adjustments,
Mhm.
doing work on the soft tissue really helps. And it's allowed me to do work for example, I have a patient who is a nurse manager. So she's on her feet a lot. And I was treating her for neck and low back pain. And she happened just to mention to me in a conversation that her foot was bothering her. And I said, oh, well, that's something I really can, the Graston technique has been very successful dealing with plantar fasciitis, Achilles tendonitis.
Oh,
So
wow.
after 2 treatments, she just couldn't believe that what a difference it made. And, we happened to work on it because she just mentioned it in a conversation. So that is something I really do like to educate people about. The chiropractors really can be full body treatment.
Mhm. Mhm. And not all chiropractors take on that modality. So that's really nice to know you have that. And,
Yes. Yep.
people can come to you for that too. So, one of the things that I was talking to you before we got on the call about is that common problem some of us have of waking up in the middle of the night with like a Charlie horse or some sort of stiffness, or
Mhm.
like in my case, what happened the other night was my foot literally sort of bent and locked up. And then I started getting pain there and all the way up. And I'm like, and I'm waking up
Yeah.
and I'm trying to massage it. I'm trying to get it to
Yeah.
stop. And it was excruciating. And is there anything that I could do or others could do when that happens? Or just maybe
Yeah.
a lifestyle shift that we need to
Yeah.
make so that it doesn't happen in the first place?
Well, so one of the key things about muscle tightness and any kind of cramping are nutritional issues. So the number one thing I always recommend, and I tell all of my new patients, to drink more water. So a good rule of thumb is to take your body weight in pounds, divide it in half, and drink that many ounces a day. And start first thing in the morning. That's when we're the most dehydrated. And that's why a lot of people feel tightness and cramping when we're in bed,
Mhm.
because we're dehydrated after, being in bed for 6 or 8 hours.
Mhm.
And the other thing that can really help is different types of either oral supplements, such as magnesium, potassium, sodium. And there is also a lot of good products out there with magnesium in them that can help for cramping.
Mhm.
Some of my patients use magnesium lotion. So it's just like a body lotion that has magnesium added to it. So massaging that on your legs before you go to bed can help reduce that.
Oh.
Pickle juice is a great supplement to make sure your sodium levels are proper. And tonic water is another good one that people use.
And when you say pickle juice, literally grab the pickle juice from a jar, or is
Yeah.
there something like,
Yeah.
wow,
Yeah. A lot of athletes use that now.
wow, that's cool to know. I'll have to pick up some pickles to have in the house for emergency. Although I hope my husband doesn't think I'm pregnant when I'm like, get the pickles.
Right.
Oh no, not at this age, I hope, for sure. For sure. So, what are some other things I think? First of all, I just want to say this other comment that really amazes me is how the whole nervous system running through the spine actually
Mhm.
affects where we're having that problem. I know I've had chiropractic before, and I thought it was kind of interesting to learn that I might have a pain in one area and the chiropractor would work on another area or on my
Mhm.
spine a certain way to alleviate that pain. Are there some sort of interconnections that are going on like that in the body that are um, not that we can, have people self-diagnose or anything, but it's sort of like, oh, if you have this, maybe this is out of alignment, or if you have the, like I'm thinking in terms of specifically what you said with the looking over at the
Mhm.
shoulder that presents itself up here, but maybe there's other places, like maybe the hips start to fall out, or maybe
Yep.
the ankles or the knees, or I don't know.
Um, yeah, so we know because we know the map of the nervous system and where the nerves where they exit the spine, we know where they go in the rest of the body. So a great example of that is, as you mentioned, people looking down. So when people look down, that affects mainly their lower cervical spine or their upper thoracic spine. There's a set of nerves that exit that area called your brachial plexus, and those nerves come out and come all the way down your arm to your hand. So if somebody comes in and they have pain radiating down their arm, um, we know which levels of the vertebrae to work on for that, and also which muscles those nerves travel through. So it may be sometimes it can be what's called a double crush syndrome, where maybe you have some tightness in your spine or a little bit of a herniated disc, but then you can also have some muscle tightness, and both of those pressure points is enough to create the symptom, which in my example would be pain radiating down the arm.
Mm.
Another great example of that that's common, especially now that we sit a lot, is sciatica. And that is basically a general term that means pain radiating down your leg. So people might be having the pain in their ankle or their calf or their thigh, but it's actually a problem in their lower spine and hip area. So again, we can kind of trace back where the pain is to where the nerves come from in the spine and work on those joints, both adjusting them and making sure that there's no soft tissue. Another thing that can happen is what's called a trigger point, which is a little ball of tight muscle. So alleviating all of that tightness, recommending ice to get rid of any inflammation. So that's really how we can determine where in the spine we're working based on the symptoms.
Mm, wow. It's just, every time I hear things like this, it just amazes me at our incredible human body, right? And how
Yes,
it works,
absolutely.
and just the, connectedness of everything. And I think when
Mhm.
we're thinking about whole life health, there's all these aspects that we don't necessarily pay attention to, that we take for granted. And I love that
Mhm.
you're able to bring people back to a balance so their body can naturally create the homeostasis that we're designed
Yes.
to do.
Yep. And
That's
a lot of things, a lot of things that bring us back to our natural state of health are simple. As I mentioned, water's a big one. Daily stretching is a big one. And that's one thing I really encourage my patients is to, be responsible for their own health care rather than, you know, going to a doctor and being prescribed a pill. Of course, that's needed for certain things,
Mhm.
but a lot of other things we can help ourselves, through diet, nutrition, exercise, um, things like that.
Mm. We didn't talk about this, but I'd like to just quickly invite you, if you want, to talk about the essential oils, because I know I saw on your website you also offer essential oils, and I
Mhm,
know the doTERRA brand is a beautiful brand. I've heard of it. I've used it.
mhm.
What do you think is something that maybe people don't understand about how that helps our overall well-being?
Well, the oils can be used for different things. Some of them can be used for inflammation. Some of them can be used, in different ways. Like for example, in the office, we have what's called a diffuser, which is a little machine it's almost like a little a mini humidifier.
Yes.
And you can put water and then a few drops of different oils in that to one, it smells great, but also different oils can be very calming. They can help with anxiety. And so there's just some people actually cook with some essential oils. There's a lots of different ways that they can be used. I use a product in my office. It's a doTERRA product. It's called Deep Blue. So it's a lotion that I use with the Graston tools, and it has a special proprietary blend of oils that help with pain and inflammation.
Nice, nice. So people can get that from you by going on your website. I know there's a link right on Duxbury Wellness
Yes,
website. And
correct.
do you sell anything with magnesium or no?
I don't.
Okay. Okay, we can find those in just the health food store or
The health food store
Hmm,
or, anywhere online, probably.
okay, okay.
I know that's
So
how a lot of people this past year have been shopping.
I know, believe me, I used to have a store and they were doing it before
Oh,
we
no.
had pandemic and now that's the new norm and it's okay. It's, you kind of adjust
Yep.
with the world and all that. But I think that this information is really, really beneficial for people. I think a lot of people, when they hear chiropractic, if they haven't had the experience, it's just sort of an over there thing. Like they don't
Yes.
feel an urgency to start
Mhm.
investigating. And you've made it so simple to understand just kind of some simple mechanics on how you approach the body. And,
Mhm.
it's a very sophisticated system we have here. And
It
using
is.
somebody like Ali, in terms of a consistent practice, I think is something you can do not only when you have a pain, but she can check and make sure things are in alignment and that you're not like sort of setting yourself up for patterns that can cause pain going on. So
Yes.
any
Yeah.
takeaways that you'd like people to be thinking about, Ali, as they
Um, One thing that I think it's important for people to know, especially about our practice here, in Duxbury Wellness Center, we've really strived to create an environment that's very relaxing and very individualized to each patient. So we don't have one, a lot of patients come in for the first time and they've heard about somebody going to the chiropractor and having to go like 3 times a week for 3 months. And we really have an individualized plan for every person. So I have people that want to come in and get adjusted every week. I have some people that want to come in maybe for a specific problem. So I see them for a, finite amount of time.
Mhm.
Um, and so really our goal with both chiropractic and massage is to really individualize people's plans so that they feel comfortable and that, we're at the optimal level of benefiting what they need for their body.
Mhm. Well, that's, I think, good news for people when they're kind of worried about starting something and thinking maybe for time or financial reasons they can't
Right.
be consistent. That even one session to start and assess
Hmm.
and get things in good place is definitely a valuable investment for our health. And
Yes.
when you can do what you're saying, be proactive and have
Yep.
some tools you can do at home, it's totally worth it. So I'm just
Absolutely.
I'm excited. I'm excited to get on your table myself.
Oh,
And
good.
if there's anything else you want to say, anything for closing that we can kind of leave people with and
Um, just, we treat um, people of all ages and different athletic abilities, different health status. One thing that a lot of people think of somebody going to a chiropractor for an acute injury, like a car accident is a very common reason why people get introduced to chiropractic.
Mhm.
But really anybody can benefit from chiropractic care. And as I mentioned before, it doesn't have to be a long-term um, commitment if they're nervous about that at first. And also we're always available for a free consultation if they just have general questions. I'm happy to speak with anybody about what their issue or concerns might be.
Oh, that's wonderful. So how will people get in touch with you? I know we'll put links in the write-up, but why don't we just
Okay.
say it out loud so they know?
Okay, so they could go to my website, which is duxburywellness.com, or they can call us at 781-934-0020. And I also have an email, ali@duxburywellness.com.
Fantastic. Well, thank you so much for being with us and for sharing your tips of wisdom.
Thank you for having me.
And I am very excited to get back over to your office
Oh,
and
good.
experience what you're offering, Ali. So thank you so much.
All right, Nancy, great to see you.
Have a great weekend.
You too. Bye-bye.
Bye-bye.